to our second podcast from DIAD 5th edition. My name is Dr. Khadija Al Jefri and I'm one of the organizers, and today I am speaking to Dr. Sara El-Toukhy. Welcome, Dr. Sara.
Thank you so much for having me. It's a pleasure.
Dr. Sara has come all the way from Egypt to join us. Dr. Sara, I wish you welcome. I'm so happy to meet you. I follow you on social media and I'm very impressed with everything that you're doing.
Thank you.
So it's such a pleasure to speak to you today.
Pleasure's all mine. First of all, it's such an honor to be here. First time and definitely not the last time. I'm originally a dentist from Egypt, but I have 2 masters in dentistry and then I shifted and now I'm American board certified aesthetic medicine. And my base in dentistry made me so good with injectables because I have a very big base with anatomy and I analyze the face differently. And this is one of my talks that I'm gonna do on Sunday.
Yes, so actually my sister is a dentist. And her specialty is orthodontics. And in the UK, really to do orthodontics, you have to understand about the anatomy of the face and do maxillofacial, not as a maxillofacial surgeon, but as a maxillofacial fellow.
Yes.
So she explained to me how much work they have to do with the knowledge of the anatomy of the face.
Exactly.
So this is the reason why, because some of the viewers or the followers might not understand why dentists could inject if they are not dermatologists. And this is the reason why. If you're a dental surgeon, then you have a good grasp of the anatomy of the face.
Of the layers and everything, and how the bone and the teeth structure affect the whole face. And this is how we put the fillers in the right positions to get you whatever they ask for. So actually, being a dentist added so much more to my practice because when I analyze the whole face, the layers, the teeth, occlusion, everything, so I can have a treatment plan for my patient to put everything on the right position. So that's why it made me a little bit different in the practice.
That's great. It's nice to have different perspectives when you're doing the job that you're doing.
Yeah.
طيب, I want to talk about the choices of talks that you're giving because صراحة it's quite brave. You chose, let's not say difficult talks, but يعني controversial talks.
Yes.
The first title of your talk was Curious
Case of Difficult Patients.
Curious Case of Difficult Patients. Can you tell us a little bit about it?
The idea is of an aesthetic medicine, it is wide. وكل يوم بيجيلنا more and more patients, and we are not heart surgeons. Okay, and it's up to you to choose your patients. You have to read the patient when the patient's coming in. So كل patient ليه demand مختلف. So you have to be a little bit of شوية psychology مع شوية علم مع شوية analysis, so you can read the body language and the signs. Because some patients are really easy to deal with, and some patients need containment, and some patients you just need to send them away. Because we can't all. After all, you're human. So what I'm presenting is difficult 3 patients and how I handled
each case.
Each case of them, and when to send the patient away, when to agree with the patient, and when to disagree with the plan.
I totally agree with you. In the world of aesthetics, we're not just dealing with the patient's demands for maybe beautification or fixing things in the face.
Exactly.
There's also expectations.
Yes.
There's also sometimes you're dealing with the psychology of the patient. So the patient wants something.
100%.
And what they want is reflected in
everything they ask you for.
Everything they ask you for.
And in the treatment and in the result and everything. So if you don't manage the psychology from the beginning, you will not get a treatment plan that both of you will be happy with.
Have you ever come across a case where a patient is asking you to do something, but the reason why they're asking you to change the way that they look with the injectables is because of another reason? يعني مثلا هم حصل لهم موقف, or something has happened, or they're feeling bad about something, and what's going to fix is not the injectables, but actually dealing with the underlying psychological issue.
A patient came in and she's like, if I don't do under eye fillers today, I'm gonna get divorced. And my husband sent me to fix my face because I don't want him to divorce me. And here was the problem was not the under eyes. It was the problem, the communication between the man and the woman aslan. So even if he wants to divorce her, he will divorce her whether her eyes are filled or not. And once I got a patient that she wanted to look like her AI. Remember, كان في موضة كده where everyone was AI. She got the picture of the AI and she's like, I want to look this way. Can you make me alienated a little bit like my AI?
Yeah, there was a publication that talked about this, that we want to look more and more like our Snapchat filters.
Exactly.
So us doctors, dermatologists, we have to have an open mind. We have to have an open heart as well, understanding for the patient's needs. We be supportive. And at the end of the day, the safety of the patient comes first.
Exactly.
Okay. Okay. So, Dr. Sara, tell us about your second talk now.
Okay, my second talk is where my dentistry comes in hand. I had a very, very nice patient that flew all the way from London, and she was massively injected. But she was injected on a very wrong scale, and she did not look good. So she didn't know what was wrong, and she saw me across the internet, and she came back to check with me. I dissolved all the fillers. She paid 10,000 grands for it. British pounds, can you imagine? And we dissolved the whole thing. I started my dental analysis because she had a problem dental-wise and skeletal-wise. And this is when I knew where the problem was, and I fixed her with fillers. And she got all what she wanted without orthodontic surgery because her medical condition cannot be into any surgeries or operations. And now it's our 3rd year follow-up, and she's great.
MashaAllah, bravo, Dr. Sara. So I follow you on social media, as I said, and your results are fantastic.
Thank you so much.
So I guess the lesson from this second talk that you're trying to say to us, that it's important for the doctor to plan, and for you as, I don't want to say patients because they're not really sometimes patients when they're coming for aesthetic things, so المراجعين, to know who you're going to and to have an understanding that the doctor and yourself are on the same page of your let's say your beautification journey.
Exactly. This is the most important thing. To trust your patients and trust the results and trust the process.
Trust the process.
Yes, to trust the process is the most important thing.
Finally, I want to ask you how you're liking Dubai.
I love Dubai. It's the cosmopolitan everything. I love it. It's not my first time here. It's actually my 7th or 8th time.
Wow.
I have a lot of friends living here all around the nationalities. So Dubai is like a second home.
We're very happy to have hosted you in our podcast today. Thank you, Dr. Sara, for joining us.
Thank you. Thank you so much, Dr.
Thank you, Dr. Sara.
Pleasure.